Well, it's now being recommended by the Journal of, American Medical Association that adults 19 through 64, including those who are pregnant and postpartum, get screened for anxiety disorders using questionnaires and other screening tools at their regular checkups with their primary care providers. Why is this the case? How is anxiety typically diagnosed and then treated? All those answers coming very soon from our next guest, Kanat Edelson, a psychotherapist at the Birmingham Maple Clinic, joining us for our weekly mental health segment on today's edition of the Megacast. Lori, thank you so much for being with us today.
Thank you for having me.
Glad to have you on. We know that the pandemic has had a number of different mental health effects on people all across the board. One of the most common was anxiety disorders. Is that really the big culprit behind this new recommendation that adults 19 through 64 and some others also get screened for anxiety disorders when they go for their regular checkups?
My guess is that it was really the most significant factor because there's been such an increase in the diagnosis of anxiety among adults in the U.S. Certainly, it has been a significant mental health problem long before COVID, but COVID really exacerbated the situation and ramped up our awareness of how prevalent it is in the U.S. I will say, too, that they've also recommended screening for depression, not just for anxiety, but both.
Yeah, this was a recommendation that was made earlier this week on Tuesday by the U.S.
Right.
Preventative Services Task Force in the Journal of the American Medical Association for Primary Care Providers. And it's interesting because anxiety isn't a one-size-fits-all disorder. It manifests itself in so many different ways. And so with that being the case, how do anxiety disorders typically get diagnosed in patients and then ultimately lead them into some form of treatment?
Sure. So the most common symptom of an anxiety disorder is worry, but persistent, serious worry that does not abate, that is present for at least 2 weeks constantly, but often it can be present for years. And it's not just run-of-the-mill worry, which we all experience. It's more severe than that. Very often it's focused on specific things like germs or dying or safety or actually specific bodily functions. People also often have fears about vomiting or fears about choking or not being able to breathe without medical explanations for having those disorders at all. It's more or less a worry that's in their head and that persists and impacts their ability to function in other areas of their life.
And it doesn't just affect them mentally or affect them emotionally. Anxiety can have some pretty significant physiological effects as well.
Absolutely. So there are also very typically somatic symptoms, body symptoms. They can include breathing issues, heart rate issues, sweating issues, feeling extremely fatigued or unable to sleep. I mean, it can go either way, appetite issues. Some people actually break out in hives or rashes from stress, and that's related to anxiety. And most commonly we hear about palpitations, trembling, shaking, and profuse sweating.
Especially when anxiety becomes present in someone at a younger age. We think about our kids having gone through the COVID-19 pandemic in and out of school, in and out of the regular socialization and other sort of rites of passage that you typically go through when you are a child or a teen. How can that then provide even more significant effects over the lifetime of someone if they're experiencing anxiety from a young age and it's going untreated?
Well, we know that anxiety has some biologic and genetic piece to it. So very often if a parent or both parents or grandparents have a history of an anxiety disorder, it's not unusual that a child would be exhibiting signs of an anxiety disorder in their early years. And if we do identify and diagnose an anxiety disorder in childhood, it's very, very important because most of the time, if that goes untreated and unchecked, it will get worse as the child ages, and they will eventually come to our attention, and we'll be able to trace back symptoms of anxiety into childhood. What we know is if we can diagnose it early, we have a better chance of helping children learn how to better manage their worries, their fears before they get so profound, before they become so profound that they just feel completely controlled by them. Last year in June, I think, of 2022, this same medical task force developed criteria to diagnose and assess anxiety symptoms in children on over the age of 8. So that's been around for about a year.
We're joined on today's edition of the Megacast by Lori Kanat Edelson, a psychotherapist at the Birmingham Maple Clinic. You can find more information, get in contact with Lori and the other professionals at the Birmingham Maple Clinic on birminghammaple.com, and join them and us each and every week for our mental health segment, civiccentertv.com/megacast for more information and all of those past segments, which do include some on this issue of anxiety. For more context, again, on Tuesday, the U.S. Preventative Services Task Force recommended in the Journal of the American Medical Association that primary care providers begin asking patients about feelings of anxiety during routine checkups and providing screening for anxiety disorders using questionnaires and other screening methods. And so, Lori, given that anxiety, A, manifests itself in so many different ways, B, affects people of all ages, how typically, as a professional in the mental health sector, do you and other professionals across medicine then screen for anxiety?
So we typically ask all kinds of questions just at an initial phone call. When someone is calling in for therapy, we ask sort of a basic array of questions to determine what it looks like this patient or this person is dealing with. And then at the first visit, at the intake visit, we administer, actually prior to their visit, questionnaires to rule in or rule out the problems of anxiety, depression, other major mood issues, substance abuse. So in the mental health field, we're doing a lot of screening right away, right up front. For medical professions, this is something newer. Some doctors, some primary care and family medicine docs have been screening for anxiety and depression for many years, long before this task force recommended it across the board. They've been sort of ahead of the curve. And now that this is being recommended on a national scale, hopefully all doctors will start screening. They have very brief questionnaires. They're not threatening. They're not difficult. They're paper and pencil questionnaires. You don't have to speak out loud in front of a group of people about symptoms, but it's pretty much a symptom screener. And when the doctors see enough evidence that there are some, enough positive responses to symptoms, then hopefully they're going to be doing some recommendation in terms of whether they want to refer to a therapist, ask more questions to rule things in or rule out, and consider treatment that would be appropriate for the patient.
A consultation with a therapist, one of the many different ways that anxiety disorders may be treated. What are some other methods that are also used either by mental health professionals, by other clinical professionals, and beyond?
So medications are also very effective in many cases for anxiety, depression, and many other mental health issues. We are also assessing whether there are enough factors to consider an evaluation with a psychiatrist, which would be an evaluation for medication, to see whether medication alone or medication in combination with some form of psychotherapy would be the best way to proceed with treatment for the patient. Very often family history has some of this too.
In terms of outcomes, how does the treatment often help these individuals either cope with their anxiety and live somewhat comfortably despite that being a factor, or at the very best, maybe even eliminate that anxiety by way of helping them develop ways to cope with that so it doesn't affect their daily life?
I don't know the statistics, the current statistics about how often, what is the percentage of effectiveness for adults or children who use therapy and or medication to alleviate symptoms. I only have evidence in my own practice and in the clinic where we have, close to 39 therapists, 4 psychiatrists. We've been in business for 50 years. We've been doing this work for a very long time, and the success rates are pretty profound. Again, I would prefer to look at National Institute of Mental Health statistics. I don't have them at hand to see what the effectiveness rate is for each therapy individually and in combination, medication and therapy.
And so to bring this all together, Lori, for parents especially, as we talked earlier about the effects that anxiety can have on kids across their childhood and then into adulthood, but also for those that are in that 19 to 64 category that the task force is really focusing on with this directive or recommendation for primary care providers. If they're feeling these sort of symptoms that we talked about today, what are some of those first steps you would recommend that they take to get themselves properly screened and hopefully ultimately treated for their anxiety?
So I think they need to talk to the person that they're most comfortable talking with first. That may be a family physician. It may be a psychotherapist. It may be someone in the clergy. It may be someone in their family or at the workplace, to at least see if they can get some idea of a professional that they have been referred to talk about their concerns about their mental health. There are a lot of online mental health services right now. We always prefer that they get a word of mouth recommendation from someone they respect and trust, as opposed to just sort of jumping online and entering this kind of myriad of resources that the efficacy of which we can't yet prove. So that's the first thing I would recommend. I also want to comment about something that this study and these national recommendations are talking about, and that is before the age of 65. And I'm not sure why this study is limited to before the age of 65, because many, many, many adults who are 65 and older are experiencing anxiety and depression at even higher rates than adults between 19 and 64. So we don't want to exclude individuals over the age of 64. We want to make sure that they too realize that their symptoms are real and really do need screening and appropriate treatment. First of all, appropriate attention to determine whether they need treatment or not. But I wouldn't exclude our senior population, which is growing every year, because anxiety and depression is very real for them too.
You can get in contact with the professionals at the Birmingham Maple Clinic to screen for anxiety, to talk about any other mental health ailments that you may be feeling and experiencing each and every day. BirminghamMaple.com is their website for more information. Lori, thank you so much for joining us today.
Thank you so much for having me.